Good afternoon and welcome. My name is Mandy Mullins, and today we'll be discussing emerging substances of misuse. This program is brought to you by Southern Illinois University Edwardsville and the Illinois Prescription Monitoring Program. Your objectives for today are to name 5 new drugs that are being misused and understand how they affect people, and identify at risk populations for substance misuse. Today, we'll begin with a fundamental definition. Emerging substances of misuse refer to new or previously unrecognized drugs that are increasingly being used and misused. These substances often present unique challenges in terms of detection, treatment, and public health response. Over the past 20 years, we've seen a significant rise in substance misuse driven by several key factors listed here. Let's explore these in a little bit more detail. The first factor is the increased availability of synthetic drugs. These include things like synthetic cannabinoids and stimulants, which are often more potent and dangerous than their natural counterparts. With advancements in manufacturing techniques, these substances can be produced quickly and distributed pretty widely, making them a lot more accessible to users. Secondly, online marketplaces have revolutionized how drugs are bought and sold. The internet allows users to find these substances anonymously, often through the dark web, without paper prescriptions if it is a prescription medication. And this has dramatically increased the availability, which attracts a wider audience, especially in younger individuals who may not have had access to these substances otherwise. Next, we also have to consider the evolution of drug trends and cultural shifts. As societal attitudes towards drugs change, new substances start to gain popularity. So, for example, certain synthetic drugs that are marketed as legal highs appeal to those looking to evade some of the current or more traditional drug laws that are in place. Media representation and also influence from someone's peers also plays significant roles in shaping these trends as well. Finally, the economic impact of this crisis is staggering. It's estimated that the healthcare costs associated with substance misuse is approximately $442 billion each year. This includes expenses from a variety of different scenarios, but it includes those related to emergency care, treatment programs, long term health complications from substance misuse. The financial burden not only affects the healthcare systems, but also the families and communities that are dealing with the fallout of this substance misuse. On the graph on the screen, you can see that the number of drug overdose deaths by drug and drug classes is overall decreasing, which is fantastic news. However, if you look at the different categories on this graph that have been trended over the past 10 years or so, you can see that they include cocaine, heroin, methadone, natural and semi synthetic opioids, psychostimulants with abuse potential, and synthetic opioids excluding methadone. So while this looks promising, and it is, we do also have other concerns now with these emerging drugs of misuse because oftentimes they don't fit into any of these categories. So, as we see these categories trending down in drug overdose deaths, it is possible that we will start to see an increase in overdose deaths when involving some of these other emerging substances of misuse. Let's look at some examples of emerging substances of misuse. Now, if you go and scour the internet, you may find that there are a lot more substances of misuse that are on the rise in the United States. While that is true, I tried to highlight the most common or the ones that are most widely looked at because of their potential for harmful outcomes. Sometimes you'll see these referred to as novel psychoactive substances or NPSs or designer drugs. First, we have our synthetic cannabinoids. These are things such as K2 or spice. We have synthetic benzodiazepines. Here we have bromazolam, we have desalkylgidazepam, and we also have flubrorazepam. Next, we have cat. Then, from the cat plant, we have synthetic cathinones, which include bath salts and flaca. Then we get into our synthetic opioids or opioid analogs. Here we have things like brorphine, U-47-700, and nitazines. And then last, if you've heard of this, is tianeptine, which is also known as gas station heroin. Let's delve into synthetic cannabinoids first, commonly known by various brand and street names. These include, again, things like K2 or Spice, but also Black Magic, Paradise, and many others. Each of these names represents a unique blend of the synthetic chemicals designed to mimic the effects of THC, the main psychoactive component of cannabis. While they are intended to replicate the psychoactive effects of THC, these substances are often misused for their intense high. Users may be drawn to them under the misconception that they're safer alternatives to traditional cannabis. However, the reality is far, far more complex. Unfortunately, misuse of synthetic cannabinoids can lead to very serious adverse drug effects. These substances can cause significant increases in blood pressure and heart rate, putting users at risk for cardiovascular problems. More alarming than that, users may also experience unconsciousness, tremors, seizures, and hallucinations. These effects can vary widely because the chemical composition of each of these synthetic cannabinoids is often unknown, which leads to unpredictable and dangerous outcomes. Moreover, individuals may face psychological effects such as agitation and anxiety. The intense and often uncomfortable experiences associated with these drugs can exacerbate pre existing mental health issues, contribute to a cycle of misuse and dependency, and adversely affect others. Let's now explore synthetic benzodiazepines, or designer benzodiazepines, which is a group of synthetic drugs that include substances like bromazolam, desalkylgidazepam, and flubrorazepam, among many others. There are actually about 30 different designer benzodiazepines currently available on the market. These substances are designed to mimic the effects of classic benzodiazepines, such as diazepam or lorazepam. However, they often produce stronger sedation and heightened amnesia compared to the traditional and approved benzodiazepines, which makes them particularly concerning in terms of misuse and abuse. Unfortunately, the misuse of these designer benzodiazepines can lead to severe adverse drug effects. One of the most dangerous is, of course, respiratory depression, which can significantly slow or stop our breathing. This condition does require immediate medical attention to prevent fatal outcomes. The risk of death is a grim reality associated with these substances. Overdosing on these designer benzodiazepines can lead to a cascade of health failures, and combined with other CNS depressants like alcohol or opioids, that escalates that danger even more so. The unpredictability of these drugs combined with their potency possesses a serious risk to these users. Next, let's talk about cat. Cat, also known as African salad or Abyssinian tea, is a plant that is commonly chewed for its stimulant like effects. It has been used for centuries in various cultures, particularly in East Africa and the Arabian Peninsula. People misuse cat primarily for its stimulant properties, which can create a feeling of euphoria and increased energy when used. However, the active ingredients in cat, which are caffeine and cathinone, have significant effects on the body and mind. Unfortunately, the misuse of cat can lead to a range of adverse drug effects. Users may experience delusions, paranoia, nightmares, and hallucinations, making it a substance that can profoundly impact any pre existing or not pre existing mental health conditions. Physical effects are also a concern. Users often report hyperactivity along with an increase in blood pressure and heart rate, which can clearly pose risks to cardiovascular health. Additionally, if used chronically, it can lead to brown staining of the teeth, which is, again, a physical manifestation of prolonged consumption. Chronic users of cat can also result in physical exhaustion, increased aggression, and even violence in some cases. Users may also experience suicidal ideations, which highlights the serious mental health risks associated again with the long term use of this. Similar to the cat plant and the effects of misuse of cat that we learned about on the previous slide, let's talk about synthetic cathinones, which you might also hear referred to as synthetic stimulants. These substances are derived from the cat plant and are designed to mimic the effects of powerful stimulants like cocaine, methamphetamine, and ecstasy. Bath salts are often marketed under various names such as Bliss, Blue Silk, Cloud Nine, Meow Meow, and White Knight. These marketing strategies really aim to disguise their true nature and avoid detection, making them appealing to users looking for a potent high while evading discovery on drug tests. The misuse of bath salts can lead to severe adverse drug effects, such as confusion, acute psychosis, which can manifest actually as disorientation or detachment from reality. Additionally, the agitation, combativeness, and aggression are common behavioral changes seen in those under the influence. The physical health risks associated with bath salts are pretty alarming if you look at them here on the screen. There can be a breakdown of muscle fibers leading to serious complications, as well as the potential for seizures. The unpredictability of all of these adverse effects really underscores the dangers of these synthetic substances, which can include many other serious health issues. Another synthetic stimulant similar to bath salts is flakka, also known as alpha PVP. This is often referred to as gravel due to its appearance. Flakka shares many of the same risks and adverse effects as bath salts. The adverse effects of flakka can be particularly severe, such as experiencing paranoia, hallucinations, which can actually escalate into episodes of violent aggression or self harm. The unpredictable nature of these substances makes them extremely dangerous for users and those around them. Next, let's talk about synthetic opioids or opioid analogs. This group includes things like brorphine, U-47-700, often referred to as U4 or pink heroin, nitazines, and many others. These drugs have emerged in the illicit or recreational market and are causing significant alarm due to their potency. If you look at the literature and the current research, it suggests that these substances may be even more potent than fentanyl, a powerful opioid that we know has already contributed to a devastating number of overdose deaths. This increased potency means that even very, very small amounts of these substances can lead to severe effects, which heightens the risk associated with their misuse. Users typically seek out these synthetic opioids for their opioid like effects, which can include things that we think of like euphoria and pain relief. However, these effects also come with a lot of risks, making them particularly dangerous. The misuse of these substances can lead to severe adverse drug effects. Most commonly reported effects include sedation and respiratory depression, which can slow or again stop our breathing entirely, which is the leading cause of death in opioid overdoses. The potency of these drugs amplifies these dangers, particularly when used in combination again with other CNS depressants, things like benzodiazepines or alcohol. These synthetic opioids have been identified in numerous fatal overdose cases, unfortunately. The combination of their potency and the unpredictable nature of these illicit drugs often results in devastating outcomes for users, their families, and of course, their communities. Lastly, let's talk about xylazine and tranquilizers. Xylazine is commonly referred to as tranq or tranq dope when mixed with fentanyl. It is commercially available as a veterinary sedative and analgesic, and it's primarily used to sedate animals during procedures. However, its misuse in human populations has become increasingly concerning, particularly when mixed with other substances like fentanyl and other opioids. Xylazine acts as a centrally acting alpha 2 agonist and a norepinephrine reuptake inhibitor. It does also exhibit potential weak kappa opioid agonist activity, and these mechanisms combined is what contributes to its sedative effects, but also raises significant safety concerns when used outside of the controlled environment. Unfortunately, the use of xylazine can lead to some severe health issues. As you may have guessed, it may contribute to respiratory depression, which we know is particularly dangerous, especially when combined with things like opioids. Additionally, users may experience bradycardia along with severe cutaneous ulcerations, which are wounds that can be really debilitating and painful. Recent data does suggest that xylazine may be found in as much as 32% of illicit opioid samples in Illinois alone. This startling statistic highlights the growing trend of polydrug use and the need for increased awareness and intervention strategies in communities that are affected by opioid misuse. Similar to some of the effects from our synthetic opioids, let's now talk about tianeptine. Tianeptine is an atypical tricyclic antidepressant that has really garnered a lot of attention due to its unique properties and significant risks. Its structural characteristics set it apart from traditional antidepressants, which leads to a range of effects that can be a lot more concerning. Tianeptine functions as a mu opioid receptor agonist, meaning it binds to the same receptors in the brain as our opioids do. This interaction and this binding can produce effects similar to those of opioid medications, which is a critical factor to consider given the ongoing opioid crisis. While tianeptine is available for use in some countries as an antidepressant because of its atypical antidepressant structure, its accessibility also leads to a lot of misuse. In many places, it can be easily obtained, which heightens the risk associated with its use. Due to its opioid like effects, tianeptine is often referred to as gas station heroin. This nickname underscores its availability and the perception that it can deliver a similar high to traditional heroin, despite being sold under the guise of a legal medication. Alarmingly, tianeptine has been found in many dietary supplements and unapproved drugs. A lot of the time, consumers may unknowingly take these products with this tianeptine in it while seeking what they think to be a harmless option for either mood enhancement, stress relief, things of that nature, which is putting their health at serious risk. The misuse of tianeptine can lead to severe adverse drug effects. Some of the more common issues include sedation and respiratory depression, which we know can be life threatening. The potential for overdose is particularly high, especially again when combined with other substances. Unfortunately, tianeptine misuse can also result in death due to respiratory failure or overdose, and those individuals who develop dependence on tianeptine may experience withdrawal symptoms that are very, very similar to those of opioid withdrawal, which creates a challenging cycle of dependence that we know from experience with opioids really complicates recovery efforts. Now that we've briefly gone over some of the more popular emerging substances of misuse, let's look at some of our at risk populations. Understanding these factors is really important for prevention and intervention strategies down the line. Several key elements do contribute to an individual's vulnerability to developing a substance use disorder. First, let's look at family history. We know that family history plays a significant role. Individuals with a family history of substance use disorders are at a higher risk for developing similar issues themselves. This genetic predisposition can influence behavior and increase the susceptibility of that person to a use disorder. Genetics also plays a critical part in substance misuse. Certain genetic markers may affect how individuals metabolize drugs, respond to substances, or experience cravings. Research right now does indicate that these biological factors can significantly influence the likelihood of developing a substance use disorder. Trauma is another really important and essential factor. Individuals who have experienced traumatic events such as abuse, neglect, or violence in their past may turn to substances as a coping mechanism. Oftentimes, they may be self medicating, and this can lead to a cycle of dependence, like we previously mentioned, making trauma survivors particularly vulnerable to developing a substance use disorder. Lastly, let's look at access to drugs. This is another really important aspect of substance misuse risk. Individuals with easier access to substances, whether that's through peers and social circles, availability in their environment, or even prescription medications, are more likely to engage in misuse. This accessibility can significantly increase the likelihood of developing a substance use disorder. Given what we now know about at risk populations, how do we prevent someone in one of those categories or not in one of those categories from developing a substance use disorder or even engaging in misuse behaviors? Prevention is a key to reducing the rates of substance misuse and ensuring healthier communities. Several critical factors contribute to these successful preventative measures. First, healthy relationships is really fundamental. Supportive connections with family and friends can provide a lot of emotional stability and resilience against stressors. When individuals feel connected and valued, they are less likely to turn to substances as a coping mechanism. Second, financial stability. Financial stability also plays a significant role in prevention. Economic hardships can lead to increased stress and desperation, which often pushes individuals towards substance use as a way to kind of escape what their current circumstance may be. By promoting financial literacy and access to resources, we can help individuals build a stable foundation, which reduces their risk of substance misuse. Community based prevention programs are also essential for addressing substance misuse at a grassroots level. These programs often involve a lot of collaboration between local organizations, schools, and health services to create interventions that are tailored to those individuals. By engaging communities, we can foster environments that discourage substance misuse and promote healthy lifestyles. Lastly, education is perhaps the most powerful tool in the prevention of substance misuse. Providing accurate information about the risks associated with a lot of the use of these drugs, as well as teaching coping strategies and decision making skills, really helps individuals to make more informed choices. Educational initiatives in schools and communities can significantly reduce the likelihood of substance misuse. You may now be asking yourself, well, why isn't all of that being done? And unfortunately, there are always barriers to prevention and management of substance misuse. But understanding these obstacles is really important for developing effective strategies to combat the misuse and support those at risk populations. First, one of the major barriers is that the exact rates of substance misuse are often unknown. Many individuals who are misusing certain drugs do not seek help or report their use, which leads to an incomplete understanding of really how big the problem is. This lack of data makes it very challenging to allocate resources to the proper places and also design targeted prevention strategies. Additionally, a lot of the substance misuse is frequently not included in autopsy reports or standard drug screening processes. A lot of these drugs that we talked about today, namely the designer drugs, which are synthetic and the emerging substances, may not be tested for, which means that the true extent of how often they are used is still unknown. When these designer drugs were formulated, they were actually designed to evade being found in urine drug screens or blood tests or those autopsy reports that we talked about. So that evasion really complicates the efforts to identify and treat those who might be struggling with some misuse of these drugs, as these traditional screening processes may really fail to show us what's really going on. Another significant barrier also lies in the overall lack of access to effective treatment programs. Many individuals who need help may face many different obstacles that prevent them from receiving the care that they require. Things like geographical locations, financial situations, or just plain systemic obstacles can all impact getting access to treatment programs. Finally, the lack of funding is a critical issue that we know impacts all aspects of prevention and treatment. If we do not have enough financial resources, this can obviously hinder the development and implementation of comprehensive prevention programs, limit access to treatment, and stall research efforts really that are aimed at combating the substance misuse. Without the adequate funding, efforts to tackle this issue are significantly compromised. In conclusion, substances of misuse are constantly changing. If you recall from the very first couple of slides that we talked about today, it used to be opioids and synthetic opioids or opioid analogs that were driving our overdose deaths. However, since those are on the decline, we do expect to see a shift from our opioid analogs into some of our other synthetic substances or designer drugs. Many classes of these substances are here to stay. However, we do expect to see continued evolution of individual substances within those classes. Thank you for your participation in this module entitled Emerging Drugs of Misuse.